Good morning, everyone, and thank you for joining me today. We're going to dive into a critical and complex issue, the opioid crisis. This presentation will provide a comprehensive overview of how opioids affect the body, the patterns of abuse we see, the risks involved, and the various treatment approaches available. Together, we'll explore the mechanisms behind opioid addiction, the challenges it presents, and potential solutions to address this ongoing public health concern. Let's get started. Opioids are drugs that primarily target the nervous system to help relieve pain. They work by binding to specific receptors located in the brain and spinal cord. This binding changes how pain signals are processed, making the pain feel less intense. But opioids don't just affect pain. They also influence the brain's reward system. They boost the release of dopamine, the chemical responsible for feelings of pleasure and euphoria. This combination means opioids not only reduce pain, but also reinforce the behavior of taking the drug, creating a strong link between pain relief and pleasure. Unfortunately, this dual effect is a big reason why opioids have a high potential for misuse and addiction. Heroin is an illegal opioid derived from morphine, known for how quickly it takes effect and its high potential for addiction. On the other hand, prescription opioids like oxycodone, hydrocodone, morphine, and fentanyl are legal medications prescribed to manage moderate to severe pain. These drugs play an important role in medical treatment when used properly. However, misuse of prescription opioids is a significant problem and has contributed to widespread opioid misuse overall. What's important to note is the overlap between the non-medical use of these prescription drugs and heroin use. Many statistics highlight how some individuals start with prescription opioids and then transition to heroin, underscoring the interconnected nature of these patterns. When we look at patterns and trends in opioid abuse, one key aspect is how users often escalate their doses over time. This happens because the body builds tolerance, meaning higher doses are needed to feel the same effect, which unfortunately leads to physical dependence. Misuse doesn't just happen one way. People might take opioids orally, but some also snort or inject the drugs. Injection carries greater risks, including infections and overdose. In terms of who is affected, opioid abuse crosses age groups, but is particularly common among young adults and middle-aged people. Geographically, some regions show higher rates of abuse, often influenced by factors like local socioeconomic conditions and how opioids are prescribed in those areas. Because of all these complexities, monitoring these patterns closely is essential. It helps us develop targeted prevention strategies that can make a real difference. Opioid abuse carries a serious risk of overdose, which can cause respiratory depression and, unfortunately, death. We've seen a sharp increase in overdose incidents, especially with the rise of potent opioids like fentanyl flooding the market. Beyond overdose, opioid abuse leads to a range of health problems, including higher rates of infectious diseases and mental health disorders. It also contributes to social challenges such as unemployment and incarceration. The number of fatal overdoses makes it clear just how urgent it is to implement effective interventions. In fact, data reveals that opioid-related deaths make up a large proportion of all drug overdose fatalities, underscoring the magnitude of this crisis. When it comes to controlled intake of opioids, there are several significant challenges to consider. First, dosage management is not straightforward. Each patient responds differently due to variations in how their bodies metabolize these medications, making it difficult to find the right balance. Despite using opioids under strict medical supervision, there remains a real risk of accidental overdose, which can occur even when monitoring is careful. Additionally, patients may unintentionally increase their usage or develop tolerance over time, which complicates long-term pain management strategies. For healthcare providers, this presents a tough balancing act. They must provide effective pain relief while minimizing the risk of misuse or negative side effects. Finally, even with careful oversight, physical dependence can develop, adding another layer of complexity to treatment and requiring ongoing management. These challenges highlight why controlled opioid use demands vigilant, personalized care. The opioid epidemic has undergone significant changes over the past 20 years. It began in the late 1990s when opioids were increasingly prescribed, which set the stage for wider misuse. After this, we saw a surge in heroin use, and more recently, synthetic opioids like fentanyl have emerged, making the situation even more dangerous. Today, the epidemic is marked by alarmingly high rates of addiction and overdose deaths. Its impact goes beyond health, affecting communities and social structures across the United States and other countries as well. Several factors contribute to this crisis. Overprescribing opioids played a major role initially, but economic hardship, the easy availability of illicit drugs, and insufficient access to effective treatment have all fueled the epidemic further. To emphasize, the starting point was the increase in opioid prescriptions in the late 1990s. This practice inadvertently set off a chain reaction that has evolved with time, especially with the later rise of heroin and the more recent spike in synthetic opioids like fentanyl, which have made the crisis far more deadly and complex. When it comes to treating opioid dependence, a combination of medication-assisted therapies and behavioral interventions is key. Medications like methadone, buprenorphine, and naltrexone play a crucial role in managing withdrawal symptoms and cravings, making it easier for individuals to focus on their recovery. But medication alone isn't enough. Counseling and support groups are vital components that provide emotional support and help address the underlying issues related to addiction. However, several barriers make accessing treatment challenging. Stigma remains a significant obstacle, often deterring people from seeking the help they need. Additionally, there are limitations due to the availability of trained providers and regulatory restrictions that can restrict treatment options. To truly improve recovery outcomes and reduce the chances of relapse, it's essential to acknowledge and address these barriers. Only by doing so can we create a more supportive environment for those struggling with opioid dependence. Opioids play a vital role in managing moderate to severe pain, especially in situations like acute injuries, cancer treatment, and palliative care. However, the key challenge is finding the right balance, providing enough pain relief while minimizing the risks of misuse and addiction. To address this, guidelines recommend thorough patient assessments, setting clear dose limits, and maintaining ongoing monitoring throughout treatment. Additionally, using multimodal pain management, combining different types of therapies, can help reduce our reliance on opioids. Ultimately, developing comprehensive care plans is essential to ensure opioids are used safely and effectively for each individual patient.